One of the reasons we've learned a lot more about trauma is through the now classic ACE study. The ACE study examined adverse childhood experiences in 17,000 different individuals. Now, the original purpose of this study actually had nothing to do with trauma per se. The original purpose of this study was actually to simplify the intake process at an obesity clinic. There was some doctors that were running an obesity clinic, and they wanted to make their intake process more efficient, so they identified 10 basic themes from childhood that they were going to use to screen their patients. So here are the 10 themes that they identified. And what you'll notice is the first 5 themes, what they all have in common is these are things that can happen directly to a child. So emotional abuse, emotional neglect, physical abuse, physical neglect, and sexual abuse. And then the next 5 themes that they identified refer to conditions of the household. So, for example, households in which there's domestic violence, in other words, lots of physical aggression, or substance abuse, or mental illness in at least one of the parents, or removal of a caregiver through incarceration or through divorce or separation. What they found was, first of all, that each of these 10 themes were very strong predictors of obesity later on in life. And what they also found out was that these correlations were very linear and very clear. So in other words, the more ACEs in childhood, the more problems in adulthood.